Whether on the field of battle or during regular working conditions, our bodies are put under enormous stress. Today there are many ways to treat athletes and patients, but to discover a modality device which actually gives support without restricting range of motion or blood flow is something to behold. A device that reduces overuse on the muscles and actually enhances circulation. This is the Kinesio Taping method.
Hello, I'm Dr. Kenzo Kase. I'd like to welcome you to the Kinesio Taping method. I hope that you find this technique as beneficial to your patient as other practitioners around the world have. I'm very pleased to see the many
25 years ago, while practicing in the United States, Dr. Kenzo Kase started researching and examining a new and totally different approach to taping patients. He discovered and functional procedures to taping, there were numerous clinical benefits. After returning to his native Japan and helping develop a very special elastic tape, Dr. Kase put the concepts and principles of the Kinesio Taping method together for what would be his first of 30 books published since 1980. Since, its use has become the standard for therapeutic taping and has developed to other parts of the world. Discovered by American physical therapists and athletic trainers in 1995, Kinesio Taping has seen its use explode into the sports medicine and rehabilitation fields. Today, Kinesio Taping is practiced and utilized by athletic and medical professionals in hospitals, clinics, universities, high schools, and professional sports teams around the globe. Now, we will briefly explain the concepts of Kinesio Taping. The first rule for all Kinesio Taping applications are to first put the area or muscle being taped into an elongated or stretched position. This is done for a few reasons. Since we are stretching the area prior to taping, there is no need to stretch the tape as much. Secondly, it helps to ensure the full range of motion benefits that the techniques provide, and lastly, to ensure the full rebound effects of the special Kinesio tape. There are two basic principles of application of the Kinesio Taping method. The application principles are based on whether the goal is to do support taping or acute rehabilitation taping. First, the support taping technique includes taping for physical activities and chronic conditions involving weak muscles. Kinesio tape is applied from the origin of the muscle down to the insertion of the muscle. This is applied with a light stretch, which would be slightly less than half of the elastic capability of the Kinesio tape. As the muscle is used or contracted, the tape fibers are pulling back toward the origin of the muscle, much like the muscle contracts itself. The tape works to proprioceptively help stimulate the receptors to assist and fire the muscle during contraction. This type of support is different than traditional taping techniques because it is support through the muscles themselves. The second base technique is used for acute rehab taping, which involves overused, overcontracted muscles, inflammation, and pain. In this condition, the tape is applied from insertion to origin because an overused muscle doesn't need support but needs relaxation. The tape is now applied with very little to no stretch. Once again, the tape is helping to proprioceptively fire against the overcontracted, overused muscles and helps to shorten the muscles during contraction. This is one reason why this technique has been found to be very effective in the treatment of muscle spasms. Now, let's look at how physiological functions of Kinesio taping promote better circulation of lymph and blood and assist in reducing abnormal pressure and pain sensations. First, tissue fluid flows between the superficial and deep fascia and then circulates throughout the entire body. When trauma occurs, pressure from internal inflammation of soft tissues builds up and the space between the superficial and deep fascia narrows. This results in a restriction of tissue fluid flow. This restriction causes the tissue fluid to thicken as a kind of friction occurs between the skin and muscle. This building pressure and friction sets off the many pain and pressure receptors located in the skin, fascia, and muscles. These receptors then transmit the uncomfortable sensations to the brain. When Kinesio taping is applied for acute rehabilitation, The tape skin will form convolutions when the muscle relaxes. These convolutions are evidence that the skin has been lifted from the muscle. This enlarges the space between the skin and muscles, which promotes pain relief by taking pressure off the superficial receptors. The release of pressure is continued inward and allows the tissue fluid of lymph and blood to circulate more freely. The key to the therapeutic benefits result from the tape being worn 24 hours a day and for up to 3 to 4 days per application. By taking a closer look at qualities of the Kinesio tape, it is apparent why this tape is unique and permits application on a 24-hour-a-day basis with patient comfort. The elasticity of the Kinesio tape allows the body to have a smooth, comfortable range of motion and is approximate to the same elasticity of human skin and muscles. It's made from a very comfortable cotton that breathes with the skin and feels much like a t-shirt. It's designed very thin to be light and comfortable and to enhance lifting of the skin for greater lymphatic and pain benefits. It has air circulating waves laid into the adhesive to allow breathing and also allow moisture and sweat a place to channel out of the tape. The tape has a very mild adhesive that is heat activated in order to stay on during physical exercise and regular showering. And for the therapists who do a lot of hydrotherapy with their patients, or in cases where they are taping swimmers or moist areas of the body like the foot, an extra water resistant type is available. The next portion of our video will take us through proper taping procedures for some common clinical conditions.
What we'd like to demonstrate now is the stretch capabilities of Kinesio tape. So what I have are 4 pieces of Kinesio tape that are all the same length. And I'm going to demonstrate how much the tape will stretch according to what we'd like you to do and how much is a maximal stretch. I'll start with the first strip of Kinesio tape and place it on the table. Next, I'd like to show you that the tape is applied to the substrate or the paper material, which is approximately 10%. Now, this piece, I'm going to remove all of the stretch from the tape. This final piece, I'm going to apply with approximately 15 to 20% of the stretch. This is the stretch we'd like you to use when you're using from the origin to the insertion. A slight stretch is what we may refer to that as. From the insertion to the origin, we would like you to use very little or no stretch. You can see here the tape is onto the paper, a 10% stretch. On this strip of tape, where all the stretch is removed, the fibers have pulled apart, and you can see the material that will cause an irritation to the skin. On the second strip, you can see 15% of stretch applied to the tape. You can see the fibers have pulled apart, but you cannot see the material below. This is the amount of stretch we would like you to have when applying the tape from the origin to the insertion. A prime consideration in application of Kinesio tape is a muscle evaluation. Sometimes there may be more than one muscle involved, and it may be difficult to evaluate which is the primary muscle. In those cases, you'll need to use your judgment as to the best application technique. What we will demonstrate now is the proper application of a deltoid muscle testing. As you know, it's important to provide stabilization both proximally and distally. I'll now have the athlete raise their arm as I apply resistance. Go ahead. Okay, lower your arm. We're going to tape the lateral epicondylitis for a chronic or a weak muscle. For that purpose, we will tape from the origin to the insertion of the extensor muscle group, which originates from the lateral epicondyle. We will also then apply a strip of tape for correction to create some space to reduce pressure on that area. To begin, we'll need to measure the length of tape that we need. For all muscles, where we believe the origin is not quite there. We need to be slightly longer than that point. So from the point we believe of the origin, we want to add maybe 1 inch to 1.5 inches of our kinesio tape, and then extend it down to approximately the insertion point. So when you're measuring the tape, you want to have the athlete in a stretch position. So for the lateral epicondyle, the elbow is extended, and you can also place the athlete in ulnar deviation to maximally stretch the erector group. When you cut your tape, you may want to cut it slightly shorter to account for the stretch that you're going to apply to the tape. One helpful hint is to take the end of the tape and round it. We have found that this helps minimize the edges being caught while the patient is wearing the tape. When you cut the kinesio tape, you're going to want to leave 1.5 inches to 2 inches at the end. We will cut the tape approximately in the middle and create 2 tails. With the patient, again, in an elongated position, I will take the tape and peel the end off. To remove the kinesio tape, it's always helpful to not grab the end and pull, but to use your finger in kind of a drawing motion at the end of that tape. Touching the tape as little as possible will remove it to the beginning of the Y. Now, finding the origin of the muscle, place the base of the Y tape at that location, remembering not to have any tension on the tape at the beginning. There's never any stretch at the beginning, never any stretch at the end. These are the 2 locations that will provide irritation to your patient. With the arm still in a stretch position, I remove the tape. Now it's also helpful to remember, as I remove the tape, to not just pull it. If I pull it, the tape will wind back on itself. I want to lay the tape ends down, and I may even just gently touch them at the end to hold them in that position. Applying the tape now, I will use a slight stretch. I will take the tape, and as you see, I'm following with my finger and laying it down to begin that process to activate the glue. I've not gone all the way to the wrist. You may go slightly further if you would like, but anything below the wrist is difficult for the tape to adhere due to the oils and the contact that we have at the hand. And the opposite outside strip, we would just follow along the outside belly of the muscle. It's best not to lay the kinesio tape as much as possible over itself. The tape is designed to adhere to the skin, not to the tape. Then I would want to make sure I start to activate the acrylic glue by rubbing the tape. It's important not to rub over the end and draw your hand back. This will pull the edges up and diminish the ability of the tape to adhere. As you can see with this patient, he does have hair on his skin. This hair is not excessive, and the tape will adhere. If you do have a patient that has an amount of body hair you feel may decrease the adhesive quality of the tape, you may want to clip that body hair from that area. The next strip we'll apply is a correction tape to try to create some space in the area where this patient is having pain. To measure for the correction strip, you want to begin from the border of the ulna, across the area to be taped, and into the antecubital space. For most correction strips, particularly at the elbow, this will be approximately 2.5 to 3 squares, or 6 inches. So for this strip of tape as well, we want to round our edge, And for a correction strip, cut approximately 1/2 of the length. We will again curl the edge to start the tape. I will then line up my tape with the area of pain so that the base of my Y will approximate the beginning of my Kinesio tape strip here. With any correction, as with any Kinesio tape, there is no stretch at the beginning. I will then hold the beginning, apply a moderate to almost full stretch on the tape, and apply the base of the Y to where it comes in contact with the tape. Move your hand up to hold the pressure you've created. Hold the pressure. Extend the arm so he's in a functional position. These two tails are laid down with either a slight tension or no tension. This strip that's close to the antecubital fossa or space needs to be laid down, not in the fossa, because as the athlete moves or patient moves to flexion, you do not want to irritate that skin with the tape. And we have tried to create, right where the location of the pain is, some space by pulling the skin up to that area. When removing the tape, it's important to remember to not grip and rip. What would be very helpful is sometimes the patient or athlete may want to have showered, which may help the tape come off. And when you remove the tape, pull the tape on one edge, apply tension to the tape, and then apply tension to the skin, pulling the skin away from the tape. And as you do so, you will see very little or no hair removal from the patient. The longer the tape is applied, the more adhesive it becomes, and the more difficult it may be to remove the tape. For demonstration purposes, we're going to show you a chronic rotator cuff injury. So we will be taping the muscles from the origin to the insertion. Your patient may be an acute injury, and in that case you may tape these muscles from the insertion towards the origin. As you know, there are many muscles involved with the rotator cuff. For the day's demonstration, we are going to show the deltoid as a group. We will tape the anterior deltoid and the supraspinatus. Upon your evaluation of your patient, you may find other muscles that are involved. And at that time, you may select other taping techniques to use for the rotator cuff. To begin, we must measure the length of tape that we need. It's important to remember that we want the tape to overlay the origin or the insertion point by 1 inch or maybe 1.5 inches. So make the tape slightly longer at that point and then measure down to the insertion point. You may cut it a little shorter to account for the stretch or the pull that you're going to have on the tape. To start, the patient is in a neutral position when I begin my tape. I'm going to tape the deltoid as a group. I'm going to put the base of my Y at the approximation of the origin of the muscle and have my tape end with no pressure past that point. Remembering to pull the tape and not allow it to curl, I will then turn my patient, have them abduct and externally rotate. I may even want to hook their hand on my side. You may even, if you'd like, have them look away for maximal stretch. I'm then going to follow along the anterior border, applying a slight stretch and rubbing the tape before I release my pressure. Have the athlete flex horizontal, following the posterior angle of the deltoid. Some adhesion. Second muscle is the supraspinatus. measuring above the spine of the scapula, and maybe adding a little extra for this muscle. As he goes into the stretch position, the skin will elongate. So either I should measure him in an elongated position or add a little extra tape while I'm measuring. Again, beginning the base of the Y at the origin, then placing in a stretch position, turn slightly toward, yeah, got it comfortable. To assist in the demonstration, we'll have the patient sit down. Then place the patient in an arm in a stretch position and apply the Kinesio tape following the path of the muscle. We'll now cover the anterior deltoid. Please stand. Measuring the length of tape. Again, beginning the base of our Y at the origin of the muscle, then placing the patient in a stretch position, and then stretching the posterior fibers of the anterior deltoid. Lastly, we'll apply a correction strip to assist in the position of the shoulder. This can be done in one of two ways. You can, if you're trained, use a myofascial winding technique to pull the tissue into the position you want it to be and use Kinesio tape to hold it there. Or you can use Kinesio tape and apply pressure to the tape to pull the fascia in the skin where you'd like it to be. I'm going to apply pressure to the Kinesio tape. So we would measure initially out on the anterior roundness of the deltoid and then measure approximately past the midpoint of the shoulder. So somewhere between 3.5 and 4 squares would be an average length. I would recommend that for these techniques you may want to cut it a little longer when you first start. My tails would be approximately 1/2 or slightly longer than the total length of my tape. No tension at the beginning, making sure that any tape is to the skin, not on any other layer of tape, or it will not adhere. I then want to make sure that my arm is in an externally rotated position. I then would hold the beginning of my tape with no tension and apply moderate to nearly all tension removed, slowly pulling the tape to pull the shoulder into an externally rotated position, almost taking all the stretch out of the tape. Pulling it across, moving my hand to hold that pressure on the body and then relieve the pressure on the tail so that they're very loose. Then I would position the patient, still keeping the external rotation, apply my tails with slight or very little pressure, so that the patient should feel a tendency now, when his arm is hanging, to be pulling in an external or an open position. Now we're going to be demonstrating a Kinesio taping technique for low back spasm, or strain. We will be taping the sacrospinalis muscles. The tape will be applied from the insertion to the origin to help reduce spasm and tension within the muscle tissue. Lastly, we will apply a correction technique across the area with the most pain to create some space and reduce pressure in that location. To begin, we will measure the length of tape. You must be aware that with patients that this technique is going to have to be applied very low in the low back region. So make sure that your patient is comfortable with maybe their shorts or their dress being removed and exposing that area, or being in an appropriate location to do that. We will measure from approximately the sacroiliac joint to about T12 region. You will need 2 strips of tape for this technique. Start the patient in a standing position. Let's turn you just slightly. Begin the application with the tape starting at approximately the sacroiliac joint. Begin with no pressure and have the patient forward flex through the maximum range of motion they're allowed. Again, place the patient in flexion. Lastly, we'll apply a correction strip to try to create space in the specific area where the patient is having pain. You'll want to measure the tape to approximately cover the entire low back area, and in this case, about 6 squares. For the application of this tape, you're going to tear it in the middle. Pull the tape from the 2 sides till you have approximately 1 inch or 1.5 inches at both ends. Then have the patient go into a flexed position. Go forward for me. Take all the stretch out of the tape and apply it across the area of pain in the low back, leaving the last 1 to 2 inches with no tension. Okay, please stand up. And now turn. Now, Kinesio taping technique, we will do patella tracking. This is a very common condition that you may see in your practice. For this taping technique, we will apply 1 tape along the vastus medialis and along the vastus medialis obliquus, specifically to assist with weakness that may be occurring in that muscle. Then we will apply 2 corrective techniques to assist through the stretch of the kinesio tape, to apply tension to direct the patella to move more in a medial direction. You may at times have seen techniques that will use pressure with the hand or direct pressure with the tape to position the patella. With this technique, we will be using the stretch in the tape on the skin to position the patella medially. In your practice, you may need to tape different muscles, or you may want to apply the corrective strips in a little different angle depending upon what your patient has. To begin, we'll measure the tape for the vastus medialis obliquus. Going to apply the tape from the origin to the insertion, applying slight tension down to the VMO, around the patella, aiming for the tibial tuberosity. Now we'll reposition the patient to apply the mechanical strips for medial pressure. We're going to measure the tape with the first strip above and angled slightly over the VMO, getting pressure along the medial aspect, but not getting any tape back in the space medially in the popliteal region. This will be approximately 3.5 squares. Position the superior strip at an angle coming through the VMO to the superior aspect of the patella. Lay the beginning down with no tension. Hold the tension at the superior aspect of the patella. Now remove all stretch from the tape, angling across the superior aspect of the patella, and for approximately the last 1/2 inch to an inch, no tension. The lower tail on that strip angled down for the inferior aspect of the patella, taking all the stretch out of the tape, and again, no stretch the last 1/2 inch to 1 inch. Making sure you rub that tape because that is going to want to remove itself before the adhesion begins. The second strip we're going to want to position directly medially, but being very careful in the popliteal space that you not catch those folds of skin, because that will be very irritating. So even though it would be more mechanically correct to be lower, let's start a little bit higher for patient comfort. Again, no tension at the beginning. Base of the tape at the border of the patella, and taking all the tension out of the tape around the inferior border of the patella. No tension at the end. All the tension out of the tape. No tension at the end. With the patella tracking kinesio tape technique that we've shown you, we've taped the vastus medialis for a weakness, and we've used the kinesio tape with the stretch in the tape to apply a pressure around the patella to give it a medial pull. You may find in your practice that you'll want to angle these mechanical strips a little differently, or you may want to tape various other muscles. But we've found this to be a very effective technique for patella tracking problems. Plantar fasciitis is a very common condition that you may see in your practice. That's the next kinesio taping technique that we're going to demonstrate. We're going to do this in several ways. Primarily, we're going to use tape to assist the plantar fascia, to assist the bands of the plantar fascia, by taking and removing all of the tension out of the tape. Second, we're going to continue that strip of tape up along posteriorly along the soleus muscle to assist the soleus tendon. Third, we're going to use a mechanical correction to assist with the arch, which may be dropped, may be flat, which may be putting greater pressure on the plantar fasciitis and causing plantar fasciitis. This is a combination, so it's a little difficult to measure it accurately. So we're going to approximate it, and in the end, when we do the plantar fascia strips, you'll probably end up needing to cut a little bit because it's very difficult to exactly know how much we need. So we're going to measure from the heads of the metatarsals, along the plantar surface, around the calcaneus, and along the soleus to the musculotendinous junction of the gastrocnemius and the soleus. As I have that tape in my approximate position, I'm going to come back to the calcaneus, tear the tape in the middle, remove several inches on either side, and then apply the middle of that along the calcaneus. Placing the foot in a dorsiflexed position, I'm going to apply the tape from the insertion to the origin, so there'll be very little or no tension applied to the tape. Next, we'll need to cut the strips and make a fan out of the lower half of the tape. So to apply the plantar fascia strips, we're going to approximate the metatarsal heads and cut this tape just a little bit less than you think you may need, because we're going to take all the stretch out of the tape. Then, cutting the tape into 4 strips, keeping the foot in a neutral position or slightly dorsiflexed, we will pull all of the stretch out of the tape. We can do this because the skin on the bottom of the foot is very thick, and there will not be an irritation to that tissue. Remember, the bottom, the base of the foot, is very moist. You will want to use the water-resistant tape since there's so much moisture in this region. Last, we'll apply a mechanical correction strip to assist the arch. We'll use the tape and measure from the 5th metatarsal across the plantar surface, aiming for the tarsonavicular joint and adding just a little bit extra to maybe get towards the medial malleolus. In beginning this tape, make sure that it's not lower than the base of the 5th metatarsal, which may irritate the foot. There are 2 ways that you could apply this mechanical correction. You can use one hand and roll or pull the plantar fascia in the arch, hold that, and then apply your tape. Or you may use the tape itself. First, place the patient in dorsiflexion. Hold it there for me, please. Pull across at an angle, trying to get to the tarsonavicular joint, removing all tension of the tape. Once you get to the medial aspect of the arch, release your tension and lay the end of your tape without any pull at all. Making sure you rub, especially on the plantar surface, because of the moisture that is present. And relax your foot, please. And you should see in between the strips on the plantar fascia a pulling together of the skin on the plantar surface of the foot. That concludes a demonstration of the Kinesio taping techniques for some common conditions that you may see in your clinic and practice. If you've not had a lot of experience with Kinesio tape, maybe this opened your eyes or given you an opportunity, and you may want to further pursue this. If you'd like to, you may start by doing tapings on just individual muscles, and as you practice and get a little better, you may move to some of these more advanced conditions. I know when I began, I didn't know exactly what to do, and I started with the basic muscles, and as I felt more comfortable, I added in some of these advanced techniques. It may be helpful for you to talk to fellow colleagues or those around you, and you may want to schedule a workshop or a seminar in your clinic or facility.
For your further development in Kinesio taping, there are 2 books available: the Illustrated Kinesio Taping Book and the Perfect Manual of Kinesio Taping. The Illustrated Kinesio Taping Book goes over the basic principles and concepts of the method, along with step-by-step directions on how to tape different muscles with clinical indications, as well as touching on some neurological taping techniques. The Perfect Manual of Kinesio Taping is a practical handbook of taping techniques for various clinical conditions such as hallux valgus, tenosynovitis, carpal tunnel syndrome, and patella tendonitis. More for the therapist with more basic knowledge on kinesio taping, the Perfect Manual does not contain principles, concepts, and specific anatomy of taping procedures. Both are available from your local or national supply distributor.